Hey everyone, and happy Wednesday. Hope everyone is enjoying their week so far. Welcome to our Baptist Health Talk with the Doc session. I'm Jean, your host for today, and I'm really excited to be with you all, and of course with our special speaker, who I will introduce in just a second. But our topic for today is talking about protecting the skin that you're in, specifically on sun exposure. So now that it's summertime, we're all outside, we definitely need to talk about this. So I want to introduce our speaker for today, Dr. Brandon Beal. So Dr. Beal, thanks so much for being here with me today. I'm excited to have you here.
Well, thanks so much for having me. I really appreciate it.
Yeah, absolutely. So would you mind telling us a little bit about yourself and your practice?
Absolutely. So I'm a board certified dermatologist and I'm a fellowship trained Mohs surgeon. I completed my dermatology training at Cleveland Clinic in Cleveland, Ohio. And then I did further specialty training with the Mohs surgery and facial reconstructive fellowshipping as well. I practice at Jacksonville Skin Cancer Specialists, and we specialize in treating skin cancer from the rarest to most complex lesions to the routine. And we specialize in the surgical management, but also non-surgical management of skin cancer. And we also do full body skin exams and skin cancer screenings.
Awesome. That's so great. And, like I said, now that it's summertime, we're outside, we're really going to talk more about the preventative side of things, right, Dr. Beal? And of course, if anybody has any questions at all, we have Dr. Beal's attention today, so feel free to chime in on the conversation. We would love to hear from you. And I have to say for myself, this is a personal topic of interest to me because, of course, I have red hair, so I definitely need to protect my skin from the sun. But I have to say that this applies to everybody. So hope everyone is listening in on some of these tips and tricks, because we're not only talking about skin and sun safety, but also anti-aging, right? We're going to have some beauty tips in there, right, Dr. Beal?
Absolutely, yes.
Right.
We're saving those for the end.
Yes, saving those best for last, right?
Exactly.
So to get our conversation kind of started, why is it important for us to protect our skin from the sun?
Mm-hmm. Absolutely. Well, when you think about the skin, it's actually the largest organ of the body, which is very cool. And its major function is to provide a barrier for us. So it protects us. It protects us from the sun, but it protects us from infection. It provides cushioning. So if we get hit or fall, it provides that cushioning. So you want to be kind to your skin and protect it because it is protecting you. The part of a healthy lifestyle is diet and exercise, but also part of a healthy lifestyle is taking care of your skin and proper skincare and sun safety.
Okay. And so why is it that, protecting our skin from the sun, like what impact does that have on our skin?
Absolutely. So when the sun hits our skin, it actually causes DNA damage of our skin. And our skin does a really good job of repairing that. But that DNA damage builds up over time and it leads to decreased collagen, decreased elastic tissue, which actually increase your wrinkles, increase skin aging. And over time, that DNA damage can lead to mutations which cause skin cancer. And so the leading cause of skin cancer for most skin cancers, over 95%, is due to sun damage. And so when we think of that sun damage, we think of a cup and that cup filling up. So 1 or 2 sunburns isn't the end of the world, but it's cumulative sun damage over your lifetime. And so everybody's cup is a different size. Everybody has a different amount of sun. In Florida, we have a lot of sun. And so as that cup fills up, if you imagine that when it spills over, it can spill over into skin cancer. And that's what we get concerned about. And that's why we want to prevent that. And there's stuff we can do to limit our sun exposure, but also to protect ourselves. So even if that cup is filling up, we can actually help drain that cup. And that's what we're going to talk about today as well.
Oh, okay. Interesting. So would you say majority of how we can protect our skin is a lot about some of our personal behaviors that we do? Yeah.
Absolutely. So, I've never told any patient to not boat, to not golf, to not go to the beach. So I want everybody to enjoy those things, but we also have to respect the sun and realize, it's there as well. So broad spectrum sunscreen is really important. We recommend an SPF. The SPF stands for sun protective factor of 30 or greater. 50, 75 are all really well. When the average person, when we apply sunscreen, we're actually applying about half as much as you're supposed to.
Oh,
So when it says SPF 30, you're really getting an SPF 15. So that's important to apply enough of that. The other things you can do to protect yourself from the sun, obviously wear a hat. The baseball cap isn't quite that good. It really just protects your forehead. So those broad brim hats, which are in style and actually they're gaining a lot of traction, which is really good. So sunscreen, broad rim hat, and then sun protective clothing. So there's a lot of stores out there selling really lightweight, cooling clothing. So despite it being summertime, protecting those areas, top of the shoulders via the chest, they get a lot of sun damage is extremely important because that's kind of where those cup fills up, and that's the most most skin cancers are on the head and neck, 80 to 90%.
oh, actually didn't know that. And so when you say, you buy SPF 30, but really you're getting SPF 15, is it about how we apply? And do you have any tips of ways that we should apply sunscreen better for the best protection?
Mm-hmm. Absolutely. So when you apply sunscreen to your entire body, you're supposed to use 1 ounce, and 1 ounce is about the size of a shot glass. Okay, if you imagine that. So that's what you're supposed to be using. So if you buy a bottle, that bottle should not last you the entire summer. And so you want to be using enough of it. For your face, you can think of about a tablespoon of sunscreen, for the face and neck area, something like that. So there's different measurements and stuff, but make sure you're applying enough. If you're using the sprays work great as well. Make sure you're rubbing them in. So you also have to be, we've all been on the beach, seen somebody using the spray sunscreen, and most of it's blowing in the wind. And so you want to make sure it's close enough to your skin, even spraying it in your hand and then rubbing on, that it's actually getting on your skin. That's very important. And then giving it at least 30 minutes, ideally even maybe 45 minutes to dry in your skin is important. We don't want to spray right on, jump in the ocean before it's dried in your skin.
Yeah, and that was going to be my next question was, how long before? But so we want to make sure that it's the sunscreen's dried on our skin, and then pretty much if we did reapply it, didn't wait, and then went into it would basically have no protection, right? It would just kind of wash right off.
Yeah, you get some protection. It's better than nothing, but ideally you would let it dry for that 30 minutes. The things to note too, and you brought up a really good point, and we were talking about being in the water. You want a sunscreen that's water resistant. So that's extremely important, because even if you do all the right stuff and the sunscreen's not water resistant, it's just going to wash off in the water. So you want to make sure that when you pick out a sunscreen, there's 3 really important things to look for. One is it broad spectrum? So that means does it protect from UVA and UVB light? And that's really important. So broad spectrum. 2 is SPF 30 or greater. Okay. And 3 is water resistant. So great sunscreens, and there are many out there, have those 3 key components.
Okay, awesome. And I know, Dr. Beal, you provided me some great resources about sunscreen. So for our viewers, check in the comments here. I'm going to post just a little info, so you have something to refer back to on sunscreen, which has all those things, which is great. And one other thing, Dr. Beal, should we be reapplying sunscreen as we're, throughout the day? Or is it kind of like a put on once and then you're good?
Yeah, it's a very good question. So ideally, you'd like to reapply. The recommendation is every 2 hours. Okay. Many people find that hard to do, and I completely understand. You're at the beach, you're having fun, or you're golfing. But the thing to know, when you take a break, maybe in the middle of your golf round after 9, you're playing 18 holes, at hole 9, reapply. Or if you're at the beach and you get there in the morning and it's lunchtime, reapply. If you're feeling that an area is getting hot or might be getting sunburned, reapply. Also think about seeking shade at that point, or wearing protective clothing. So those are some things to know. But reapplying after every 2 hours, that's the ideal, the recommended. But when there are breaks in your day or breaks in whatever you're doing, that's a great time to think about, hey, I need to reapply.
Yeah, great tips on that. And I know it's always when I'm like, oh, I feel a little warm, I got to reapply now. Yeah. Certainly, you can you kind of feel it and you have those cues. So that's great advice though. Like when you take a break, just, reapply. I really like that a lot. So I know as the summertime comes around, and I've, seen it over the past few years about some of, concerning chemicals and like articles about that. So could you talk to us a little bit about maybe just some information about if there are some harmful chemicals in sunscreen and kind of what we should look out for when picking one that will work for us?
Absolutely. So there have been more concerns about the sunscreen. Are they systemically absorbed in the body when you apply them? And then also reef safety. Do they bleach or contribute to the bleaching of coral reefs? And those are two important things that are being studied and looked at. So the thing to note, there are two, first of all, sunscreens are regulated by the FDA. And there's ongoing research into all those things, which is really important and good because we want to get to the bottom of it and investigate it. There are two main types of sunscreen. There's the physical blockers, and those are like titanium dioxide or zinc oxide. And they work very well. They work by actually physically blocking the sun's rays. The FDA has labeled those compounds as GRAS, or generally recognized as safe. Okay, and those sunscreens have not been implicated in bleaching of the reefs or any coral issues, as well as have much less systemic absorption, if any at all. And they tend to be gentler on the skin. So those are your physical blockers. Your chemical blockers, the way they work is they actually absorb the sun's rays and convert that into heat and prevent the DNA damage. And there are many different types. Oxybenzone is one of the more common ones, avobenzone, and there's many others as well that the FDA has approved for the use of sunscreens. Those, there is some systemic absorption with those. Oxybenzone's been around since 1978. And while it does have about 1% to 2% systemic absorption, they've never found since 1978 any issues with human health or anything like that. But they have studied it, and it has become an important area of study. As far as coral reef bleaching, the state of Hawaii banned the oxybenzone specifically, that specific ingredient, due to implications and possibly bleaching of coral reefs. It's this, it's a little controversial exactly if that causes it. Certainly at extremely high concentrations, which you can achieve in a laboratory setting, but not in nature, it definitely causes bleaching of the coral reefs. When it gets in the ocean, there's obviously a very lot of water. There's a lot of diffusion that happens. And so, with that particular matter being at 14 parts per billion or 76 parts per billion, is that contributing to, the health of the coral reefs? And that's under study, and it's, there's good arguments on both sides. So it's tough to say.
Yeah. So that particular, so when reading, I guess, the ingredients list of a sunscreen and choosing, so oxybenzones, that's what you would say to kind of look out for, to what's the word I'm looking for, to try to not have in a sunscreen? Or what would you say for someone who's just going to the store trying to purchase one?
Sure. I would say, to date, it's been shown to be safe. And,
Okay.
I would say that's perfectly fine to use. It's in some of the sunscreens I use. So personally, it just, if you're concerned about that, then you want to choose a zinc oxide or titanium dioxide sunscreen. So if that's something that's important to you, the most important thing is the best sunscreen is the one that you'll use. And that's with those three key things, with the water resistant, SPF greater than 30, and broad spectrum. And so those are the one you'll use. So if you're concerned about the systemic absorption, then the zinc oxide, titanium dioxide are the way to go. So it really depends on that personal preference. There's studies there's still ongoing studies on that systemic absorption and on the coral reefs. Is that really the case happening? And I think we certainly need more studies and to look further into it to see it conclusively, is it really doing that? Or is it just in a laboratory setting where we can create these extremely high concentrations? So that's unclear.
Yeah. Okay. Great. Well, thank you for going over that with us. I know that's always, something that, again, like I said, pops up. I see that in articles on the news right
Mhm.
before summer starts and those things. So, thank you for providing some clarity on that. And I know we've talked a lot about sunscreens, which I think is a super important factor in skin protection, all of that, because we've obviously focused so much. But and then we talked about, seeking shade and hats and covering our skin. But are there any other behaviors or tips you would say for prevention for skin cancer?
Well, skin cancer, it's really preventing. It's twofold. So preventing those severe sunburns. We want to do that. That's very important. And then it's cumulative sun damage over your life, and realizing that the parts of us that are always exposed are our head and neck, and that's why 80 to 90% of skin cancers are in our head and neck. So keeping those covered. The sun is strongest from about 11 a.m. to 2 to 3 p.m. in that range. So just realizing that's when it's at its peak intensity. Um, and so that's an important thing to realize. If you can schedule stuff around that, I would just say just be cognizant that the middle of the afternoon, the sun's the most intense. And so just take those extra precautions. Seeking shade is also really important. A lot of times you look on one side of the street, it's shady. The other side of the street is sunny. Pick the shady side of the street. Go to the
Mhm.
beach, bring an umbrella. And if you're at your kid's baseball game or soccer game, go for the tree, go for the shade versus sitting out there for 2 hours watching the game in the sun. So those are just little things, but over a lifetime, those little decisions accumulate to really help prevent skin cancer, and they make a big difference.
Yeah, that's awesome. Well, I have to say, I'm an evening beach goer. I love to go in the evenings. So, and
Okay.
that's just for me in the summertime, just because it's so hot. But
Mhm.
that's good to know, especially like just some times and something to think about for, if you need a break in the day, maybe the, early afternoon or whatever it is probably the best time to do that. So, great advice
Mhm.
on that. So now that we talked about kind of protecting our sun a little bit more and those tips, we also want to talk a little bit about that anti-aging, right? So I know in learning about just skin cancer prevention or just care for your skin that the sun has a huge factor in kind of that aging of our skin, right? So how
Mhm.
does protecting our skin have that anti-aging effect?
Absolutely. So there's really three components to anti-aging and anti-aging skincare routine. One is a moisturizer, and the second one is a sunscreen, and the third one is a retinol or retinoid. And what I recommend patients doing is combining the moisturizer and the sunscreen. You just eliminated a step there, and that way your moisturizer has sunscreen. And so every day I wake up, I put on after I shower, I put on a moisturizer on my face. That moisturizer has SPF 30. I don't have to think about it. I get protection every single day. Um, the sun, again, decreases our collagen, uh, decreases our elastic tissue, and that's going to contribute to aging. It's called extrinsic aging. So there's intrinsic aging, which is just the natural aging of the body, and then there's extrinsic factors. Smoking cigarettes or is a huge contributor to skin aging, and then the sun is another huge one. So the sun will decrease our elastic tissue, and that the elastic tissue is what prevents wrinkles. So the suns will increase your wrinkles. It causes brown spots, dyspigmentation, and other pigmentation irregularities, as well as increasing wrinkles. The moisturizer helps again protect your skin, hydrate the skin. Dry skin is more wrinkly than moisturized and well-hydrated skin. Well-hydrated skin is more youthful. It has a more glowing appearance, and so that's where the moisturization comes in. And then the next thing is the retinol or retinoid. And we actually are very lucky now in the last couple of years because the FDA just approved the first over-the-counter retinoid. So a lot of people are using retinols, and they typically actually are more expensive. They're found in a bunch of different beauty products, but the stronger than a retinol is a retinoid. And they're all prescription except for one, and that one is adapalene. And that adapalene actually sells for $30 to $35 over the counter. It's in the acne aisle. It's as an acne medication, but you just take a pea-sized amount and you just dab it. I tell patients just dab it at 12, 3, 6, and 9, and you just rub a thin amount in. And it helps increase collagen, increase elastic tissue, decrease fine lines and wrinkles, and helps with pigmentation irregularities. So it's anti-aging, and it's one of the best anti-aging creams on the market. I tell patients it can be drying to your skin, so use it with a moisturizer. Be careful about applying it to around your eyes. The eyelid skin is the thinnest on our body, so it can definitely cause some drying. With adapalene, more is not better. You just need the thinnest amount over your face, and it works.
Oh, so then hopefully the bottle that you get lasts a long time.
It lasts probably 2 to 3 months. It's a 45-gram tube. If you use a gram a day, you probably won't use that much, but approximately. So it's going to last you a month and a half to 2 months. So it's reasonably priced at less than $1 a day.
Okay. Wow, that's interesting. I had no idea. And then the fact that there's over the counter, that's really cool. A question that kind of I thought of is how impactful is keeping ourselves hydrated, like water drinking? Does that help at all with, anti-aging?
Absolutely. So that goes, I touched on it very briefly in the beginning, but that healthy diet and exercise, and 100%. So keeping, well hydrated, drinking the recommended amount of water, especially in Florida with the humidity and everything. So we lose a lot of water. I find it difficult myself to stay well hydrated, but having that water bottle, getting one of those, reusable ones that you can keep with you is huge to stay well hydrated. Eating a healthy diet, plenty of fruits and vegetables also impacts the skin, helps with antioxidants and stuff like that. So all those things, a healthy lifestyle includes healthy skin, but that diet and exercise will also help your skin tremendously.
Yeah, no, that's great. And so it's kind of combination of all of those things. So any other tips that you can think of for us for any anti-aging or skin cancer prevention?
The other thing to note, so if a patient has one skin cancer, their risk of developing a second skin cancer in 5 years is about 50%. So that's pretty high. With that said, though, if that patient will use sunscreen every day, they can decrease their risk of skin cancer substantially by over 30%.
Wow.
So that's important to know. So just because you have that sun damage or you have that doesn't mean, there's nothing more I can do. Using sunscreen every day for 5 years, it significantly improves the health of your skin. It's shown to also have a significant cosmetic benefit of the appearance of your skin, and it also can help prevent skin cancer. So that's super important as well.
Yeah, absolutely. It looks like we have a question here from Skylar. So his question is, what is a daily skin regimen or product that you recommend for someone who does not have one currently? That's a good question.
That's a great question. So yeah, I would go with a moisturizer with a sunscreen. Some really good ones that I've used, the one I currently use is La Roche-Posay, their double AM facial moisturizer with SPF 30. But there's other good ones. CeraVe has a great facial moisturizer, an AM facial moisturizer. They have an AM and a PM, and the AM has sunscreen. So choose the one with sunscreen. But those work well. And then that adapalene gel works really well. It's over the counter. Adapalene is not the brand name, but it's the medication name. And there's different brands that make it. There's a lot of great skincare companies. One's not necessarily better than the other, but it's important just to find a moisturizer or sunscreen that you like. And then that's what I use in the morning, and then I use that adapalene at night. The other thing to consider is if you wear makeup, is that there's a lot of great makeups with sunscreens. So again, there's no reason to be applying makeup without it having a sunscreen in it. So find a really good one that you like that has the sunscreen.
Okay, awesome. Yeah, and I think that's great. So Skylar, I hope that that's helpful for you. I know part of my routine, I don't have the adapalene stuff, but I do, do the moisturizer. And you know what I'm just thinking about, Dr. Beal, is mine's only SPF 15, so I really need to bump it up a little bit to that SPF 30. But then also, like reapplying and so great advice on that. So anything else, that you want to leave our viewers with for today, just as a takeaway in talking about this topic of skin protection?
Sure. I shared a link with you earlier, and I think hopefully we can share that with our viewers. That'd be awesome. It's a patient. It's a famous photo of a truck driver that was published in the New England Journal of Medicine. And it shows the left side of his face and the right side, and it's backlit to accentuate that. But the left side, the sun has, he was a truck driver for 30, 40 years, and he had a lot of sun through the windshield, or through the, excuse me, through the window of his driving his truck. And you can see the significant wrinkling of the skin and the significant skin aging on that one side, and the other side is a lot smoother. So that just shows you the impact of the sun. But my advice is have fun, enjoy Florida, enjoy the outdoors. It's a wonderful state that we all live in, and just respect the sun. Be careful. Wear sunscreen, wear your broad brim hat, and use those sun protective behaviors. And I think you're going to do great.
Yeah, that's awesome. Great advice to leave us off with. Actually, we do have one more question if we have some time still, Dr. Beal.
Yes.
Is from Jackie. She asked, does adding a base makeup or moisturizer to a sunscreen break down the sunscreen? Actually, that's a really good question.
It is, yes. So, and thank you for asking that question. So it does not, but the key, what I would recommend is applying the sunscreen first before you apply the makeup, or ideally, again, having that moisturizer or the makeup that you're using, if it has sunscreen in it, then you're good to go, and you don't have to worry about that layering effect. So that's kind of an important thing. And there's a lot of great makeups with sunscreen out there. And the nice thing is the newer ones, you don't even notice there's sunscreen in it. When I use the moisturizer in the morning, I don't even know there's sunscreen in it. It's not greasy. It doesn't leave me with a white sheen or anything like that. I'm wearing it currently, and you can't even tell. So it's really nice. And the key is try a few, find one you like. If you don't like one, try another one. So find the one you like. It takes time. I didn't find the one I'm using now. It took me a little while, but you find it, you like it, you stick with it. So thanks for your question. But combining those will not break down the sunscreen, but I do recommend applying the sunscreen first.
Yeah, no, that's a great point. And I guess something that I thought of in thinking about makeup with sunscreen is, just like we use the regular sunscreen that we have to reapply, like you mentioned, every 2 hours. Is that true for makeup to get that protection?
Good question. So so you got it with the sunscreen and makeup. It is true. So you have to be careful with that. But the good news is makeup also provides an additional layer of protection. Usually is a physical barrier, depending on which makeup you're using. So there's a slight advantage of that you get to enjoy as well. But you just want to, obviously the makeup can get rubbed off. It can get, just life happens. And so you just want to be aware of that. And reapplying, the sunscreen definitely is recommended, or just making sure that you have that covered is important.
Yeah, awesome. Well, thanks for answering that question. All my curiosity that's coming up. Well, yeah, I don't see that we have any other questions, Dr. Beal, but this has been such a great conversation, and I just really appreciate your time in talking through this. And I hope that for our viewers out there that you've taken a lot away from this, and just we'll look into, kind of adapting some of these skin protective behaviors, just because, like Dr. Beal said, we want to respect the sun because we still want to have fun, right?
Absolutely.
Yeah, so want to let everybody know that if you're interested in learning more about Dr. Beal and his practice, I have a link above us with all of his information in there. And also, if you are looking for adopting any of those other healthy behaviors, such as we talked about hydration and nutrition, Baptist Health does have a team of health coaches that are here to help you at no cost for wellness coaching. So there's also a link above me as well with that information. But again, I just want to thank everyone so much for tuning in, and Dr. Beal, so much for your time, and I hope everyone enjoys their summer.
Thanks so much for having me. I really appreciate it.
Absolutely. We'll talk to you soon. Bye, guys.
All right. See you. Bye.